From Fox 31 News, this is Good Day Colorado.
There are prescriptions to treat everything that ails you, but they come in a one-size-fits-all pill. That's not right for everyone. So just ahead, how you can reap the benefits of these drugs without the stuff that you don't need. We're going to tell you about compounding your medications.
Well, prescription drugs have come a long way in treating disease, but not everyone needs the full doses in a pill.
And so there is a way that you can get the benefit of those drugs without getting more medication than you'll need. We'll tell you about compounding those drugs after the break. When you're at home watching TV, doesn't it seem like every commercial break has an ad for some new type of drug, and then they spend half of that commercial dedicated to listing the potential 6,000 side effects from taking just that one little pill? Well, there is a way to tailor these prescriptions so that they fit your exact needs without so many of those side effects, and it's called compounding. So here to tell us more about the benefits of compounding is Susan Davenport with Pencol Compounding Pharmacy, and Janine Shea, who is actually taking advantage of compounding with her hormone therapy. So let's start with the pharmaceutical side of it. And why is this something that isn't done for everyone all the time? It seems logical. Humans are so different that we would have different needs when it comes to that medication.
Well, that's a good question. There are a lot of things that are already available that can fit the needs of a patient, and so compounding comes in where we need to customize a medication for a patient that is different than what is already available. And so we work closely with the physicians and closely with the patients to fill a special niche.
These physicians, do you have to go to a special physician, or can you request your current physician to say, hey, I would like to see if I need that full dose?
We work with hundreds of physicians. I would say that more and more each year, more physicians are aware of the advantages of being able to use compounding and are using more individualized doses. It has really changed a lot in 15 years.
Now, Janine, you decided to do this. There's the benefits and the negatives of hormone therapy. One of the negatives, obviously, is the increased risk in breast cancer. Mm-hmm. So this seems like a positive for you. How do you like it? Can you tell a difference?
Well, I got a hysterectomy 9 years ago, and prior to that I did a lot of research just because of what you just mentioned. And I wanted to find what options I had available, number one, and number two, what were the safest options. And that's how I arrived at compounding hormones, because they could deliver to me exactly what I needed in the safest manner possible. And then I decided to go to the two pioneers that really started it in Denver, and that would be Dr. Varma and then Susan Davenport, just because of her personal journey, and it's worked out beautifully. So
you really find it, were the physicians up for this, or is it, do they kind of take it as a dig in the sense that, you know, I'm the doctor, I know what you need, and you need this prescription, you can go to Walgreens and pick it up?
To me, it was up to me to find a doc that agreed with my philosophy and that she had the same philosophy.
Okay.
And I was fortunate enough to find Dr. Varma, who had that same philosophy and had worked closely with Susan, because it worked out perfectly.
Now, Susan, how do people go about getting more information on compounding? Because, you know, convenience is an issue, access to doctors, you know, whether it's covered underneath your HMO or whatever your insurance is. How do we find out?
The way that we try to get the information to our patients is that we're available to talk to patients and talk to physicians. We have 4 pharmacists at the pharmacy, and we are on the phone all the time. I teach a monthly class that we call Midlife Wellness, because not everybody needs hormones. And I teach a class on diet, lifestyle, nutrition. How do you know if you need hormones? What are the keys that you would look for? We invite doctors to come see what we do at our pharmacy, because not all compounding pharmacies are the same. And there's really stringent guidelines for how to do the job right.
Now, quickly, as we're running out of time, is there a downside to compounding from your aspect of going and finding out that it works better for you? Were you nervous about not getting the correct amount of the hormones that you need?
Absolutely not, no, because it was specifically made just for me and exactly what my body needed.
What about Susan? What's the downside?
I frankly don't see a downside. I've been a pharmacist for 39 years, and I think that what we do provides a real service for physicians and patients.
Fantastic. Ladies, thanks for coming in.
Thank you.
It sounds like a great idea. Janine and Susan here to help you guys out at home, so if you'd like more information, you can get it from our website.